Hi, this is Cindy. I'm one of the nurses over at Dartmouth Hitchcock Urgent Care, and I was the project manager for a pilot program that we conducted at one of the DH clinics. The most efficient way to treat influenza is early diagnosis. We believe that we could do better, and in the interest of our patient care, we advocated on behalf of the DH clinic and implemented rapid influenza diagnostic testing for a trial period of 5 months. Next slide. On the agenda today, we'll talk about need, potential loss of patients, delay in treatment of illness, and provider responsibility confusion. Project description, the RIT overview, personnel needed, implementation, and evaluation. Then we'll talk about budget, conclusion, and then I'll open the floor up to some questions. Next slide, please. Need, why? Rapid influenza diagnostic testing in-house is convenient for both patients and providers. No longer will we need to outsource our specimens for testing. Our patients can be seen right here in the urgent care clinic for influenza-like illnesses, be diagnosed, treated, and then discharged all within a half hour. What's wrong with our current process? Some ramifications of our current process is losing potential patients to other clinics due to timeliness of testing procedures, delay in treatment of illness, and confusion of provider responsibility. Next slide. So we're first going to talk about the first need, potential loss of patients. According to the CDC, this year's flu season is worse than usual. Influenza or flu is an extremely contagious respiratory illness that appears most frequently in the winter and then the early spring. We are one of 4 walk-in urgent care clinics right here in Concord, New Hampshire, and we have Concord Hospital Emergency Department right across the street. Talk about competition. Next slide, please. We are the only clinic that does not use RIT in our area. Convenient MD right here in Concord invested in rapid influenza diagnostic testing this year and has since had a 10% increase in influenza clientele. Next slide. Next need is delay in treatment of illness. 45% of our specimens must be outsourced to Concord Hospital Lab for testing. 25% of them are influenza swabs. Next slide. Flu swabs are sent to Concord Hospital for stat testing. Turnaround time is 1 to 2 hours for the test to be run, 3 to 4 hours for the results to be entered. Why does it take so long? Concord Hospital is its own entity and will run their in-house stat specimens before ours. Next slide. When we finally do call the patients with results, they're most likely already home and miserable in bed. They have to come back out to pick up their medications, or they end up with a completely different plan of care than as discussed in the office. Next slide. The next need is provider responsibility confusion. Stat read results from Concord Hospital come in through our results phone, which is manned by rotating primary care nurses at the Dartmouth Clinic. Confusion occurs when the nurse notifies both the urgent care provider and the patient's primary care provider without assigning any responsibility. So at times, both providers will forward their plan of care recommendations to their own department's respected nurses, who will both end up calling the patient. The patient is then receiving extra phone calls and what may end up being conflicting orders. Next slide. 10% of reported patient dissatisfaction was due to lack of communication between hospital staff. Antiviral drugs are used to treat influenza, and they are time sensitive. Some patients will already have been experiencing symptoms for a day or so before even coming in to be seen. This time is of the essence, and if the patient is desiring more than supportive care measures. Next slide. Project description. What is the project? Our project was to obtain rapid influenza diagnostic testing into the Dartmouth Hitchcock Urgent Care, personnel needed, timetable of implementation, and then the evaluation phase. Next slide. How does it work? A provider obtains a nasal swab and inserts it into the vial containing 1 to 3 mLs of transport media, results in about 10 to 15 minutes. Next slide. How does it solve the problem? It increases diagnosis and treatment of symptoms prior to discharge, patient convenience, and decreases provider responsibility confusion. Next slide. Personnel needed for the participation. We need the CEO on board, the project manager, which was myself, department managers, urgent care providers, and survey evaluation staff. Next slide. The implementation and evaluation. We formed a project committee. We purchased the RIT kits, staff training, feedback meetings, evaluation data collection, evaluation presentation of data. Next slide. So here was our budget. Our vendor costs was $39,660, and that was for the materials. Survey evaluation team was $20,592, and that was to pay them for following up phone calls on patients. Then department management, $12,480, and that was to screen the patients and compile a call list. And the project manager, $10,290, and that was to track utilization, budget, and head up meetings. Staff training, $2,240 to train staff. Biohazard bins and disposal costs, $2,040, and that was for used kit storage and disposal. Grand total of $87,302. Next slide. Our pilot program ran for 5 months during peak flu season. 342 of tested patients were surveyed. 82%, or 280 patients, reported satisfaction with the efficiency and the timeliness of the testing. 18%, or 62 patients, reported dissatisfaction because testing was uncomfortable and invasive. Please note that those patients would have received a nasopharyngeal swab, whether we sent it to an outside lab or tested it right here in the office. The benefits of investing in the rapid influenza diagnostic testing project was faster diagnosis times, convenience for the patient, and decreased provider responsibility confusion. This will directly increase patient satisfaction scores, as well as help us retain our clientele from other walk-in urgent care clinics in the immediate area. Next slide. We have some references if you're interested in learning some more. Next slide. If anybody has any questions, you can reach me at cindy.t.louxay@hitchcock.org. Thanks for joining me today.